It is the morning of my daughter's surgery to correct a hole in her heart. I met the surgeon for the first time because he had not been available for a meeting that we had had before. As he reached to shake my hand, I grabbed his hands in mine and I blessed his hands. I asked, as you cut into our daughter, may your hands be healing hands.
Nothing in life is more important than faith, the one great moving force which we can neither weigh in the balance nor test in the crucible.
Spirituality, which pertains to ultimate meaning and purpose in life, has clinical relevance.
Hi, I'm Ben Carson, Professor and Director of Pediatric Neurosurgery at the Johns Hopkins Medical Institutions. Over the next 20 minutes, I'd like to invite you to explore with us the role of spirituality and religion in the healing process. The link between spirituality and medicine has existed for hundreds of years, since the beginning of medical training in Greece. Throughout the centuries, religious and spiritual leaders were often also healers. It is only in the 1900s that medicine shifted to a more technological focus. Currently, however, there is a renewed interest in spirituality and health, and there are some very good reasons why healthcare professionals may want to discuss spiritual issues with patients. First, surveys have shown that patients want to be able to talk about their spiritual beliefs with their doctors. This can be a very personal and rewarding type of communication for both. Since discussing spirituality may enhance communication and patient satisfaction, it deserves consideration. Second, there is a growing body of scientific evidence that spirituality may be associated with better patient outcomes. Studies suggest that patients with strong spiritual beliefs have decreased morbidity, improved ability to cope, and increased longevity. Third, there are time-efficient and sensitive ways to inquire about spirituality in medical visits. When a clinician asks a patient about spiritual issues, and that can mean just asking whether the patient has any spiritual or religious beliefs that might affect their treatment, a clinician may gain insights about the patient that improve communication, their relationship, and may affect the plan of health care. Professionals do not have to be experts in spirituality or religion to ask a patient about their spiritual values. And finally, professional organizations such as the Joint Commission on Accreditation of Healthcare Organizations and the American College of Physicians have recommended addressing spiritual issues as part of the patient's total care. To help illustrate these points, this film will provide a definition of spirituality, review studies on patient preferences regarding spirituality and health, briefly summarize some of the research about spirituality and health outcomes, examine hypothesized explanations about how spirituality helps patients, and demonstrate through role plays how clinicians can address spirituality in the medical visit.
There are multiple definitions of spirituality because individuals experience it in different ways. Some examples include,
I think spirituality to me is my belief in God, knowing that there is a presence up there.
Spirituality to me is what gives purpose and meaning to one's life.
Spirituality means to me is belief in a higher power that reminds me that whatever is happening for a reason.
Prayer, meditation, church or group devotional services.
My faith and my relationship with Jesus Christ.
To me, spirituality is forgiveness.
My beliefs as a Jew guide every action I take and every choice I make.
Gratitude for life that is perceived as a blessing.
Surveys and polls indicate that 94% of Americans believe in God. A number of medical studies illustrate the importance of spirituality to patients. One study found that 93% of the patients reported having strong religious beliefs, and 77% felt that their doctor should consider their spiritual beliefs in their care. A study of older adults in a family practice setting found that 80% agree with this statement: "My religious faith is the most important influence in my life."
One particular study in older adults of church attenders and non-church attenders showed much better levels of interleukin-6 in attenders, and that, of course, is a measure of better immune functioning.
In a recent study I conducted with my colleagues, primary care patients rated spirituality as one of the most important aspects of self-care for depression. Other researchers have found that the more religious patients were, the more quickly they recovered from depression.
Substance abuse, 138 studies in the literature, virtually 90% showing that religiously involved people are less likely to use drugs, alcohol, smoke cigarettes, etc. What's interesting in that figure is that of those 124 studies, 100 of those studies are in young people, are in adolescents, teenagers, high school students. And so, you know, the impact there at that young age can be, as you well understand, have tremendous impact over the entire lifetime of that individual.
In patients with advanced cancer, religious patients show less pain, better coping skills, greater life happiness, and greater satisfaction. A number of studies have looked at chronic diseases and spirituality. One study showed that people who attended church at least once a week and who prayed and read the Bible daily had much lower blood pressure than those who did not. In a 23-year longitudinal study among 10,000 Israeli government employees, there was a 20% mortality risk reduction among those who were most religious compared to those who were least religious. And it's important to recognize that this was even when we controlled for well-known cardiovascular disease risk factors.
Now, this simply takes the last 5 to 6 years and puts up all the studies that have looked at the relationship between religious involvement and overall length of life, survival. So there have been about 14 of these studies. Every single one of these 14 studies show that religiously involved people live longer.
So how does spirituality help patients cope with their illness? When we talk about cures, we're often talking about the technical aspect of medicine. But when we talk about healing, that is where spirituality comes in. And spiritual beliefs might help people understand their suffering, find meaning in their suffering, cope with their illness, accept whatever their illness has to offer them, or even find a sense of peace in the midst of tremendous suffering. In fact, some experts have suggested that spirituality may help patients in the following ways. First, as a coping mechanism in times of distress, illness, and death. Second, in improved social networks, for example, those found in churches, temples, mosques, and other spiritual communities. Third, as an aid in recovery from certain illnesses such as addiction, where patients use the 12-step program in their recovery. And finally, in promoting forgiveness and even acceptance.
I'd become a quadriplegic as a result of a diving accident in 1967 and was going through a lot of depression and discouragement. I was up at Montebello State Hospital and had to come to Johns Hopkins University for some outpatient issues, and they shoved my gurney against the side of the wall there in the rotunda. This was about 30 years ago, so they were still using the rotunda. And as I laid there, I was fighting off so much anxiety, fear. I felt abandoned, alone. I turned my head on the pillow, and there looked up into the face of this marble statue with this figure of Jesus in kind of a beatific pose of blessing. And I looked up at it and was absolutely overwhelmed with a sense of transcendence, that someone bigger than me was watching out for me. someone was caring, someone had not forgotten me. And it wasn't just a matter of religious comfort. It was a conviction and an assurance that God himself, personal, real, vibrant, alive, cared about me. And I was comforted by the fact that I had not been pushed there by the ambulance drivers by chance, waiting for my outpatient appointment, that somehow, some way, of all the gurneys to be shoved against all the hallways around Johns Hopkins, that happened to be that one at that moment where I really needed enormous comfort.
Well, even before I got arthritis, I saw my grandmother, troubled and stumbling with it. So somehow I just felt like I would be the next one in the family that did get it. Well, I think in the beginning, when the illness really became serious in the late 90s, I became very, very depressed. As a matter of fact, once I found out I couldn't work, I was devastated. I was stuck at home. I had to have someone come in and take care of me. And when you were born in the church, raised in the church, my great-grandfather was a minister. And then all these things happen to you, it kind of shakes your faith a little bit. You know, you think, why me? Why me? So for years, I still had this depressed feeling and such. But I met these people, and I go to the services, and we pray, and we sing. And when I come out, I just feel good. And I feel that the Lord has led me to the right place. So when I miss a Sunday, people are beginning to figure, wondering, well, what happened to her? And then you go back the next week, and they've got your name in the bulletin, for somebody to drop by to see you, to see if you're okay. And you can't beat that. You really can't beat that. When people ask me how things doing or what happened to me, it's that I got a new knee, I got 2 new doctors, I found a new church and a new attitude.
I was raised in the Catholic Church. In the Catholic Church, we were taught not to kill. I went to Vietnam, and they taught me to kill, and they taught me to do that very well. While I was in Vietnam, I killed a child who I did not have to kill, and I carried that guilt around for the next 25 years. During the 25 years after Vietnam, I was a heroin addict. I was in and out of treatment, but I finally went to a rehab center where a counselor, who was also a chaplain, told me a story that came out of 2 Samuel's, where David, who wanted Bathsheba, had her husband killed. God forgave him, and that was the point that the chaplain tried to make to me, that God had already forgiven me for killing the child. I realized that I had to forgive myself because God had already forgiven me, and that was the beginning of my healing process. It was also an introduction to a 12-step concept, which is based on spirituality. And I kind of focused on the 3rd step because I had to turn my will and my life over to the care of God as I understood Him. Again, like I said, that is where the process began for me. And it just got better after that. Yeah, just as the spiritual concept has worked for me over the years, I now see it working for other recovering addicts when they apply the 12-step concept. I see them get better.
Some physicians and other healthcare providers have questions about addressing spirituality in the clinical setting. Some ask, will I offend my patients? Will this take too long? Or is this out of my area of expertise? The following role plays, taken from direct patient encounters, will show you how to bring up spirituality with your patients.
So, Mr. Jones, we finished the exam, and you've been dealing with this emphysema for quite a few years. I'm not sure there's anything much more we can do with the medications. How are you doing at home with this right now?
Well, I get around pretty slowly. I get very short of breath, and it's very difficult to live by myself.
There's when you have an illness like emphysema that keeps you in the house, you tend to feel pretty isolated sometimes. And there's different ways that people get out and meet people. Some people do it with family and friends. Sometimes people belong to clubs. Some people go to church a lot. How about yourself? What of those things have helped you?
Well, I have a son, but he's busy with his own life. And I have some neighbors, but I haven't got to know them yet because they're new to the area. And as far as church goes, well, I used to go a lot before I got into the wheelchair.
Yeah. How long has it been since you actually were in church?
About a year.
Have you talked to anyone at the pastor or someone at the church to see if they could help you get into the church?
Well, they seem happy to see me when I come.
Well, before the next visit, can you please try to make sure you call somebody in that church and in the church that you went to and see if they can make arrangements. And if they say they can or there's something we can do to change it, we'll do that, because it sounds like it's important to you. It's a good way to get out and get some support from people. And a lot of my patients get a lot of spiritual comfort from going to church too, and I think that would really make a difference for you.
Okay, I'll think about it.
Spiritual connections are important for patients that have chronic medical illnesses or are facing death. And there are a couple ways that physicians can bring up the issue. If it comes up out of context, the patients frequently believe that it's the first sign of bad news and that the doctor is going to tell them something really terrible is wrong. Another way to bring it up is to talk about spirituality in the context of social support, in terms of how they interrelate with people, friends and families, clubs, or going to church. And patients have told us that's a much more natural way to bring up the subject, and they do better with that.
Mr. Davis, I'm concerned about this abdominal pain that you've described, and I think you may have an ulcer. I'm also really worried about the amount that you say you're drinking. Have you ever thought that you needed to cut down on the amount of alcohol you were drinking?
Well, I've had a few hangovers here the last couple of days, and I did miss some work last month because of it.
Mr. Davis, from what you're telling me, I think you may have a drinking problem. And it can be very, very difficult to stop. Have you ever considered going to a program like Alcoholics Anonymous?
AA? No, I don't really think it's that bad, do you?
Well, your ulcer, your lost work days, are all really strong signs to me that you may have a drinking problem. A lot of my patients have told me that AA was the most effective thing that they tried to quit drinking.
I've had some friends that are in AA. They seem to be doing well, but they talk this spiritual thing and the higher power and all. I just don't think I can get into that.
Well, do you have any spiritual beliefs that you think might help you or have ever helped you in a difficult situation?
No, just my music. My friends are my beliefs, not God.
Well, many of my patients, again, who've been in AA have said it's the most successful thing that they tried to quit drinking. And I've also heard from them that many of them had a problem with the higher power in the beginning. But they've also told me that that higher power can be anything, including music or friends. Why don't you try to quit drinking completely for a week and see how it goes? You may want to talk to your friends in AA or call the AA number.
I'll give that a try.
You know, I know that this is a lot for anyone to absorb on one visit, and I'd really like to see you again soon. Can you come back and see me next week?
Yeah, I'll come back.
The American Psychiatric Association describes addiction as a disease that takes over a person's life, displacing all else. 12-step programs such as Alcoholics Anonymous and Narcotics Anonymous are good examples of programs using spiritual beliefs to treat disease. AA and NA are not affiliated with any religious denomination. The only requirement for membership is a desire to quit drugs or alcohol. The essence of these programs is that an addict's best, if not only hope for sobriety, is by recognizing and accepting help from a higher power to help them overcome the obsession with drugs or alcohol.
Good morning. How are you doing today? Last time we talked about headaches and insomnia. Is that better?
I'm not doing so well, doctor. These headaches are really bad, and then I just can't sleep at night anymore.
You You seem very sad today. Is there anything wrong?
This is a very difficult time of the year for me. It's the anniversary of my son's death 3 years ago.
Oh, I'm so sorry.
I just feel so all alone, like nobody cares, like I don't have anybody to talk to.
This must have been an incredible loss for you. I'm so sorry that that happened. Do you have any spiritual beliefs that help you cope with feelings like this?
Well, I used to love going to church and reading my Bible, but when my son died, I became so angry. I blamed God. I thought, how could he let something like this happen?
You know, when people experience such a loss like yours, that it can be very normal to be angry, even angry at God.
I know, but I feel so guilty. Like I should be able to accept God's will, but I just can't. You know, sometimes I even feel like I deserve to be sick.
You know, in the midst of such an incredible loss and in the midst of such pain, it's often hard to see what God's will is for you. Are there friends or perhaps people at the church with whom you could talk with about these feelings?
Yeah, there's Pastor Pierce. He was at my son's funeral. He really did a beautiful job. I've often thought that I'd like to see him again and talk with him.
Well, maybe you should.
Yeah, maybe so. Maybe it would help.
You know, I'd like us to make a plan together to get through this. I think the headaches and the insomnia are in part caused by the grief and the anger and the feelings of loss that you're going through. And often it helps to talk with someone who specializes in grief counseling. So with your permission, I'd like to set up an appointment with a counselor. But I also think it might be a good idea to call Pastor Pierce. It might help.
I think it's time.
Anger at God or at the person who died or even at oneself is a very common response to loss. To deny it or to force the person to work through it quickly does not afford the person the opportunity to resolve their issues of grief at their own pace. Forgiveness may occur once a person has had that chance to work through their issues of loss. For some people, they find a sense of peace and acceptance once they are able to forgive. Patients may bring up spiritual issues in many ways, some by referring to God, a higher power, a blessing, or even their spiritual community. Some patients may wear religious or spiritual jewelry, for example, beads. These can be important cues to the physician for bringing up spirituality in the discussion with their patients.
As an introduction to a very broad and deep topic, we may have inadvertently failed to address some aspect of spirituality and healing that you feel is important. There is a growing body of literature and resources on the topic of spirituality and medicine that we encourage you to explore further. Our goal today has been to show you that spirituality is vitally important to many patients. You don't have to be an expert in spirituality to ask patients about their beliefs and to encourage patients to use these beliefs in a positive way. Discussing spirituality need not take a lot of time, and it can be time well spent, and it may lead to improved communication with patients and more positive health outcomes.
And so I think for a healthcare professional, whether it's on the highest scale of a neurosurgeon or the cafeteria workers down at, in the hospital cafeteria, I mean, all these people, they're in positions of power. And perhaps they don't realize how much power they really have. And so their words, small as though they might be, or their encouragement, spiritual especially, or their advice, all of that can have enormous impact. Because I can say for certain, and from experience, looking back, that I have very clear mental snapshots of those healthcare professionals who meant the most in my life. And they were the ones who demonstrated compassion at my bedside or by the side of my wheelchair. And so for them to offer godly advice, wisdom, counsel, spiritual direction would probably mean even more than a family member or a neighbor coming in for a visit.